Welcome to Skin Deep with your host, Sharon Morton. She's scratching below the surface and bringing you the power to make informed decisions about what's in our food, water, and products that we bring into our homes that affect our bodies. It's a show that will help you heal your mind, body, and soul. So stay tuned for all things that are skin deep.
Welcome to the Skin Deep Show here on Sirius XM Channel 141 HUR Voices. I'm your host, Sharon Morton, and we have part 2 of our Menopause show coming at you today. If you remember last week, we had Dr. Wanda Dyson, founder of Change for Life Medical Spa and Aesthetics, on the show, as well as Brenda Brown, artist, activist, and friend of the show, talking about what doctors can't or won't tell you. And that's how to live your best life, even while going through menopause. And as I said last week, for you fellas, please know that today's show isn't just for the ladies. We know that menopause affects men too, because you're the ones that have to live with us. Menopause affects everyone, including significant others, families, and even folks to work with women that are going through it. So as I always say, we're going to be doing more than just scratching the surface. Here on Skin Deep, we're giving you the power to make informed decisions about your health, and that includes improving your mind, body, and soul. So stay tuned. We'll be right back with information you just can't afford to miss here on Skin Deep.
Do you need expert advice from successful business leaders on how to start, grow, and finance your business? Tune in every week to the Small Business Report at HUR Voices on Sirius XM Channel 141 with your hosts Carl Brown and Sharon Morton. The Small Business Report gives you, the small business owner, and those thinking about starting a business, expert advice from successful business leaders around the country. Visit us at smallbusinessreport.biz and like us on Facebook. The Small Business Report, giving you the tools you need to succeed.
And welcome back to Skin Deep here on Sirius XM Channel 141. I'm your host, Sharon Morton. We're talking about menopause again today. It's a subject that's definitely worth repeating. You know, women need to know that they don't have to suffer through this change that can be debilitating for a lot of us. And last week, we had a very informative discussion with Dr. Wanda Dyson, founder of Change for Life Wellness and Aesthetics, and Minister Brenda Brown, who's a friend of the show and has experienced one of the most extreme cases of menopause, right, Brenda?
Yes, and that's what I've been told.
Yes, and Dr. Dyson told you that as well.
Dr. Dyson told me.
I've only seen one other person with symptoms as severe as yours, and she didn't sleep for about 3 months.
And you know, Dr. Dyson, tell our audience how important insomnia is. People can die from not sleeping, right?
You can die faster from not sleeping than not eating.
Are you serious?
And it affects your immune system, so it predisposes you to cancer if you're not getting enough sleep.
That's right.
You know, and a lot of people don't know that. I mean, people can actually really go crazy. We were talking about how doctors were telling women that they were crazy. They were having, mental breakdowns when they were actually going through menopause. But you can really go crazy when you don't get sleep, right, Dr.
Yes,
Definitely.
You can. Yeah.
We've seen it.
You can become...
You've seen it with Kanye West.
Yeah.
When he wasn't sleeping and staying up all night doing the Adidas designs, doing his designs and doing the tour, he had a psychotic breakdown.
Yeah, and that
so
happened.
We've seen it.
And Brenda, that happened to you in terms of insomnia,
Yeah, it did. I had an incident where I thought the police were in the house
because you weren't sleeping.
I wasn't sleeping. I was so just delirious and delusional. I thought the police had come into the house, and I said to my husband, "The police are here," and he was just I think that was just. The thing that took him over, because he was like, sweetheart, the police aren't here in the house. You're just not getting enough sleep. And he took me up the street to Hopkins Emergency Room.
Johns Hopkins,
which
Baltimore.
Didn't help me at all. I was there several times during the time when I was having the most extreme symptoms.
Yeah.
They didn't help me at all.
They weren't aware of what was happening to you.
No, they weren't helpful at all.
So what did they think was wrong with you when you went to Hopkins?
I think they thought I was nutty.
Yeah.
Yeah, just nutty. And
that
they
you were
gave
having
me
a mental breakdown.
Things to sleep. They gave me some things to sleep, which didn't help. What's the most really popular? There's something very popular now that they use for sleep.
Ambien,
yeah.
Is that what they gave you?
Which didn't work for me.
That didn't help you?
No. That didn't help me at all.
Okay, have you seen that before, Dr. Dyson, where the women, because they're going through menopause, they're suffering, from severe insomnia and nothing helps them?
Yes. The other person that I said that was as severe as she is.
The woman that didn't go?
Didn't sleep for 3 months. They had to put her on heavy psychotic drugs like Haldol
To sleep.
to get her to come down so she could sleep, because she couldn't sleep at all for 3 months. So
And-
she was also delirious and
Delusional.
and having hallucinations and things of that nature when you don't sleep.
Okay, and when you say to come down, what do you mean? What's going on? Why are you not able to sleep?
Because, as I said,
The estrogen.
the estrogen talks to your brain, and it helps the brain chemicals which calm us down and help us to sleep. It helps them to get into the brain. So when the estrogen goes down or declines, then that's what causes this whole scenario that women are going through.
And that's why I'm so glad we're talking about this, so that women can understand that they are not crazy.
Exactly.
You know, that these are things that are happening to them as they're going through the change of life, as they're going through menopause. And for some women, menopause starts early, right, Dr. Dyson? You've seen that.
I've seen it much earlier, like in their 30s even.
Are you serious?
Yes.
And how do you determine that? Like, if you're 35, you don't expect to see
Asking
menopause.
questions,
Okay.
talking. When I was in training, they said you'll find out 80% of what's wrong with the person through the history, listening to the patient.
Okay.
So I take the time to listen to the patient and find out what's going on. You'll figure it out that
Wow.
way. But also, thank God I went through it. So I have empathy. Had I not gone through it myself personally, I would not have understood.
Wow. And there are so many doctors. What about the male doctors who don't go through it, who don't have wives that
Well, I already
haven't gone
told
through
you
it?
That what I experienced.
Right.
And we were friends.
Right.
Which made it really more hurtful. Yeah. But the one thing I wanted to say too was that one of the things that happened was when I was at Hopkins one time, they said to me, "Well, how long has this been going on? When was your last period?" Well, you still couldn't be going through menopause now.
What do you
Yes.
mean? I'm confused.
In other words, they were saying that if this had started at a certain age, I'm trying not to say the age, and I was still going through it like 7 years later, it couldn't be menopause.
Oh, right. Because
Because menopause doesn't last that long. That's what they were saying.
now menopause
that's
Menopause
lasts.
is forever.
Right. That's what I was gonna
Sometimes
ask.
the
Right.
symptoms are forever.
Right. And I know
I
people-
asked my aunt, who was 80 years old, I said, "How long did your hot flashes go on?" And she looked at me like I was crazy.
Why? Because she was still having
She
them?
said she was still having them at 80.
Just like me, I'm always hot. I'm always hot all the time. You
Okay.
know, all the time I'm hot. You know that. 'Cause
Yeah,
we're
right.
with each other. I'm always saying, put the window. I don't have on a coat today.
Yeah.
Yeah.
And it's cold outside.
And it's cold outside.
Okay, so that's scary, Dr. Dyson. That is scary to say that menopause goes on forever.
for some women.
For some women.
So we're not all the same, and it doesn't manifest the same in every person. So for Brenda, hers was very severe. Mine was mildly severe, but thank God it happened to me so I could understand. I would have not understood what women were going through had it not happened to me.
All right, so women who are listening to this show can give you a call or visit your website. Give us your website, Dr. Dyson, so that they can talk to you about getting relief from whatever they're going through. Like you said, every woman is different, but whatever they're going through, what is it or how is it that they can reach you?
The website is C as in cat, F as in Frank, L as in Larry, wellness.com. And my phone number is 202-575-4660.
And so let's talk a little bit about what we were talking about last week, the metabolic syndrome. Explain that again, Dr. Dyson. What is the metabolic syndrome?
So metabolic syndrome is diabetes, high blood pressure, elevated cholesterol, elevated other fats, which we call triglycerides, and an increase in the abdomen, the size of the abdomen. And that itself predisposes to heart attack. When
Right.
you have all that going on, that's
Right.
a risk factor. So they did a study, I think it was in Iran. And what they found was they followed women. And as they went through menopause, they saw a rise in the metabolic syndrome after they went through menopause. So what we're seeing is related to menopause, heart attacks, metabolic syndrome, diabetes, etc. It's related to a decline in estrogen, but we're not recognizing it, nor are we correcting it because we've been afraid, based on the Women's Health Initiative, that use synthetic horse urine estrogen.
Well, we shouldn't use it. We should be using the bioidentical, what did you call it? The hormone.
Bioidentical hormone replacement therapy.
Right.
But the study went on for some years for women who were just on the estrogen by itself.
Mm-hmm.
And those were women who had a hysterectomy. So they could be on just the estrogen by itself.
Without the progesterone.
Without the progesterone. Because the progesterone prevents you from getting uterine cancer.
Okay.
Cancer of the womb.
Okay.
So the study went on, and even on conjugated equine estrogen, which is from the pregnant horse, they found a decrease in heart disease and a decrease in heart attack in those women.
And not an increase in the breast cancer and the other cancers? Okay.
No.
So you're promoting...
They think that it might have been related to combining the two together.
The estrogen and the progesterone.
Yes, and giving it to the women orally every day. Because they've done a study. The Danish did a study, which was almost 800,000 women. It was 798,098 women.
Okay.
And they were on every kind of hormone you can imagine. And what they found was there was a decrease in heart disease by 44% if you gave it to the women intravaginally through the vagina.
Yeah.
And a decrease of 38% if you gave it through the skin.
So
with not any increase of any of those other things.
So taking any kind of estrogen replacement therapy is going to help you. Is that basically what you're saying? Not any kind, but
it's
what the doctors are prescribing.
It's how you take it. So it's through the vagina or through the skin is what they found was best.
Okay.
And the doctor who headed the study found that a monthly bleed should happen.
Okay.
Here we go.
Nobody wants to hear that.
Nobody wants to. Okay, well.
I'll take it.
You'll take it.
Yeah, I'll take it.
All right, Brenda.
Yeah.
Well, listen.
I'm taking it.
You're taking it.
And she's taking it.
Yeah. You are, how old, Dr. Dyson?
64.
And you're fine with getting your period every month as long as you don't have to experience those.
What's the alternative?
Okay.
Hell is the
Feeling
alternative.
horrible.
And we're back here on Skin Deep. I'm your host, Sharon Morton. So we were talking about the metabolic syndrome and what that is, what that means in terms of menopause for women. And Dr. Dyson was listing a number of symptoms, including high blood pressure, diabetes, the expanding waistline. What else, Dr. Dyson? And Brenda, you were saying that you've experienced almost all of those things.
Yeah, except for diabetes. Yeah, and I'm in the gym every day, and I'm constantly trying to work on this middle.
Yeah. And so, Dr. Dyson, what I was going to ask you,
almost every day.
all of the long list of things that you told us in the last segment that happen to women when they are going through menopause. Do those things happen all at once? Is it one at a time? If you're getting an expanding waistline, should you say, well, wow, next is, high cholesterol? Or what should you do? What should you think while you're experiencing one or all of these things?
They may not happen all at once. It could be just diabetes. It could be high blood pressure. It could be a heart attack. It could be any combination.
Okay.
Of these symptoms. For my sister, hers is hair loss primarily, and she also has high blood pressure. So she's on about 3 blood pressure medicines.
Okay.
So it's different for different people. I haven't had hair loss, but I'm on bioidentical hormone replacement therapy. My blood pressure is normal, and I don't need any medication. And most of my friends my age are on some type of medication.
Some kind of medication to address the diabetes and all of the other things that are a result of the menopause.
Yes.
But what I don't understand, like Brenda, what I'm not understanding is there some kind of educational classes that these doctors should be taking so that when they see these symptoms in women, instead of prescribing all of these medications for high blood pressure and
I would say
diabetes, why aren't they saying, okay, this is a direct result of menopause? Can't they do testing to find that out, Dr. Dyson, and then just give women the prescription for hormone replacement therapy?
Not one doctor, but Dr. Dyson checked my hormones. She was the only one out of about, she said 10, and 10 is right.
She was the only one that checked her hormones.
She was the only one.
So that Dr. Dyson checking the hormones means checking the level of estrogen and making a determination.
Estrogen, progesterone, testosterone, DHEA, it's a whole panel.
Okay.
Even might look at the thyroid hormone.
Okay.
Because a lot of things can be affected, and we're all individual.
Mm-hmm.
So how it manifests is different in different people.
And so once a woman, say for instance, never had high blood pressure, she should, if she's, well, I was going to say at the age of menopause or has stopped her period and she's going through menopause, but you said even some women in their mid-30s are experiencing these symptoms.
Yes.
What should she do? Should she go to her OBGYN? Brenda just said she went to 10 different doctors. How do you know what it is that you should do if you're going to doctor after doctor and they can't tell you what's wrong?
I would honestly say that a lot of doctors are on a sort of treadmill kind of thing, that they have to see a lot of patients and for about 7 to 10 minutes per patient. So they don't really have the time to do that type of investigation, nor do they have the time to do as much research as I did around bioidentical hormone replacement therapy and menopause, because I wanted to know what's going on, and I also wanted to know, am I doing the right thing
Right. Yeah.
by prescribing this? Is
Yeah.
this good or is this bad?
Right.
I mean, in light of that Women's Health Initiative with the synthetic hormones and what happened with the increase in breast cancer and heart disease, I wanted to make sure I'm saying the right things to women.
Yeah.
And believe it or not, Sharon, a lot of the female doctors aren't sympathetic either.
Yeah, and maybe
No,
they
they're
don't.
not.
And do you think that they are educated or know, what Dr. Dyson is talking about in terms of what could be happening to women and that it is a direct result of menopause? Do you think they know or they don't care?
I think they
Really?
I think they don't care. That's been my experience.
Or
Because there
they
were
don't
3
have
doctors-
the time to care, like Dr. Dyson
Or they
was
don't
saying.
have the time to care.
Yeah.
You know,
You were going to say there were 3 doctors
there were
that were
3
females?
doctors that were females it was Dr. Dyson, Dr. Newton, and Dr. Trent.
Okay, so we'll
Yeah.
just say Dr. Dyson
Right.
was the one that...
Yeah, she was the one who finally took, did my hormones and was, and it had a remedy for me right away.
And Dr. Newton
And Dr.
was...
Dr. Newton was very sympathetic.
Okay.
And she was willing to investigate. And she's the one that told me, you could almost be near death here between this insomnia and this depression.
Wow.
And Dr. Trent, of course, is my general practitioner,
Right.
who I've had for 20 years. So
Right.
she's always very sympathetic to me.
So you
Yeah.
were fortunate to find those 3 doctors.
Yes,
But so many
yes.
women are not
You-
able
exactly,
to and don't
exactly.
have, and so many women don't even have access to good health care too. That is another.
That's another problem.
Yeah, that's another problem.
Or they don't have the money to go to a doctor that doesn't take insurance.
Right,
Or
yeah.
they don't have good insurance or, so.
Yeah. Well, that's why I'm doing the show, because I want women out there to know that they're not alone. Firstly, it's always good to know. Okay, I'm not crazy. There's millions of other women that are going through this, and then also have access to a doctor and someone else who can help them and talk to them and kind of see them through what it is that they're facing. What is it that men can do to help their significant others get through this challenging time? Because you all just scared me and said that menopause is forever. Okay.
For some people.
For some people.
Uh-huh.
All right. And so what can your boyfriend, your husband, your brother, your significant other, what can they do to help you along through this?
They can be supportive, but I hope that they love you enough to
stay.
hang in there.
Right.
Yeah.
Because some men don't, and they just leave their wives and get a younger model,
Okay.
which
That's
is
right.
why men leave their wives when they go through menopause and get, a woman in their 40s or in their 30s.
That's
Which
very
and
sad.
those women are going to go through it too.
Eventually.
Yeah,
Right.
exactly.
We
Okay.
call it a midlife crisis that the
Right.
man is going through.
Right.
But I really can understand why you would leave someone if they're acting crazy, like my aunt.
Yeah, because
I
they don't
get it.
know. You do get it. And see, I've never heard a woman say that she gets it because of what men are going through.
I get it.
You get it
I
too,
get
Brenda.
It. Yeah, as extreme as my case was, I get it. My husband was first of all frightened to death.
Okay,
Yeah, he
that's a
was
good
frightened.
thing to point out.
Right,
They're
he was
scared.
frightened to death.
Right.
And then he, as my daughters and my husband got together and would, have little mini conferences.
Okay.
About what to do and what was the next step. And my oldest daughter is a great researcher. So she was researching everything she could find.
Okay.
But had Had I been able to get to Dr. Dyson first,
Yeah.
Instead of having to go through so many doctors, I
Right.
would have been much better off, and it would have been much easier. But my husband hung in there. He began to be very sympathetic, because I'm the person that wakes up singing in the morning.
Right.
So I wasn't even getting out of the bed because I was so tired from not sleeping.
Yeah.
And I definitely wasn't singing.
And insomnia can lead to depression, right? Right, Dr. Dyson?
There's a connection.
Yeah.
Also suicide.
Exactly.
Wow.
Yeah.
Okay, we're going to have a discussion about that
Oh,
too
yeah.
later. The insomnia can lead to depression, which can lead to suicide.
Yes.
And a lot
There's
of
an increase in suicide among people who have insomnia.
wow.
Yes.
Okay. And yeah, we definitely have to talk about that. We have to I remember you telling me about some kind of study about blue light, what's going on with the phones, people using their phones more and more, and that LED light that's affecting them. They're not getting sleep, and that's leading to an increase in suicide as well. So yeah, there's a connection there. So thankfully, Dr. Dyson, we can find you at cflwellness.com and call you at the Change for Life Wellness and Aesthetics at what's your number again, Dr. Dyson?
202-575-4660.
And then Brenda, I mean, you are always a wealth of information because you've gone through it firsthand.
Yes.
You've done, and your daughter have done all of the research.
Yes.
And you were thankful and lucky enough to find
I'm blessed
doctors
enough, yes.
who were
Yes.
able to help
Yes.
you
Yes.
and get you through it.
Yes.
How do you feel now?
Oh, I feel really well, really good. I still
Is it
get
still a
very hot,
challenge?
though.
Yeah.
I still get very hot, and I sweat a lot.
Yeah.
But I feel really good.
Much better.
Yeah, much better. 100% better.
Yeah.
Yeah.
Okay, well, I can't thank you ladies enough for being on the show and helping our audience, hopefully, get through some challenging times. If they're not facing them now, then they will be down the road, right?
Yeah.
And hopefully it will be a time in their life where they can call on you, Dr. Dyson, and get some help. Again, you can reach Dr. Dyson at cflwellness.com. She is the founder of the Change for Life Wellness and Aesthetics Medical Spa. And I'm going to say right now, that's it. I'm your host, Sharon Morton, and I hope that you take the information we provided today and use it to grow your health. Please like us on Facebook at The Skin Deep Show on SiriusXM. You can tweet us at Skin Deep Radio and go to our Instagram page, Skin Deep SiriusXM. Thanks again for tuning in on all things that are skin deep.
This has been Skin Deep with your host, Sharon Morton. Thank you for listening. Tune in again next week for conversations and tips on health and healing of the mind, body, and soul.